Okay, so here we are at the Expedition Medicine National Conference. So go ahead and tell us your name and where you're from and what you thought of the event.
I'm Kathy Slater, and I'm a dermatologist from Rocky Mount, North Carolina, and I love this conference. It was one of the few conferences I've been able to sit through the whole day because the lectures were great. They were interesting, fun, and yet very informative.
Do you like Dr. Mendelsohn? Dr. Mendelsohn, our dermatologist?
Sure. I thought great dermatology lectures.
Good, good.
I've spent a lot of time overseas in medical missionary work.
Great.
And this has been very useful because my husband and I take 1 or 2 trips a year to third world countries, and it was just a great.
Well, great. Well, thanks for coming. I'm glad you enjoyed it. So here we are at the Expedition Medicine National Conference, and tell us your name and where you're from and what you do and what you thought of the conference.
Okay, my name is Sajjad Savul, and I'm a medical director for an occupational health service in Dover, Delaware.
Great.
That's a large hospital system, and I'm here because some of the employers that we have, they have workers who travel, and they go to mostly like South America and some like to the Indian subcontinent.
Sure.
And they come and seek our advice, like as their pre-travel. Like medical advice.
Sure.
And, myself, not really an expedition, I guess, traveler myself. I've traveled overseas, but
so even though you don't do a lot of really elite expeditions, you still found the conference to answer a lot of questions that you had and be pertinent to what you do.
Absolutely, and I think that the conference should be promoted like in the occupational health fields.
Sure.
For those physicians and then the mid-level providers to come and get the information.
Yeah.
Because it's very informative, not necessarily for the expedition traveler, but also for those who take care of expedition travelers or like people who go overseas for work reasons.
Good. And you've had fun?
Yes, I had a good time. Came here with my wife and children, and they're enjoying DC. And
great.
So, yes.
Well, good. Well, thanks for coming.
Right.
Good. Thanks. So here we are at the 2009 Expedition Medicine National Conference, and tell us who you are and where you're from and what you do, and then what you thought of the conference.
Okay, hi. My name's Kristen Rome, the Medical Director of the Travel Doctor Clinic in Adelaide. The Travel Doctor is one of the largest travel medicine providers in Australia, with clinics in all the states. I really enjoyed this conference. I came because myself, I don't do quite extreme type sports like climbing, but I am seeing more and more clients, patients coming in that have signed up fairly adventurous trips, like going to base camp, doing Kokoda, which is a fairly strenuous tropical jungle trek in Australia, and even self-organising fairly amazing trips through Africa, driving for 3, 4, 5, 6 months through pretty austere environments. So I've learnt a lot here. There have been a couple of tips, insights from people who've done these trips a lot, and it would definitely help me in my consulting process with the clients to point out risks and maybe how they can better manage them.
So it's not so much that you're going on the trips, but you're consulting on patients that are getting ready to go and having returned from some of these extreme trips, and you found it helpful, the information that you've had.
Absolutely helpful. When I come back, I will do a summary, distribute the information on an internal a kind of what do you call it again, kind of email internet site, and to point out what I found helpful. And I definitely would encourage practitioners in travel medicine to attend this kind of conference, because it does give you a bit of an insight.
And just the other thing to know is that now it's going to be available online, so if they can't fly all the way over from Australia, we'd love to have them if they can, but if they can't, they can get on CME Download and they can check out the videos and
absolutely. I think that's really great, because it gives me a chance. I mean, I've been writing all these copious notes, but it will give me a chance to go back and review some things. So I think that's an excellent idea.
Great. Well, thanks for coming.
Thank you, Kath.
I'm an otolaryngologist who enjoys learning about travel medicine. I also lead trips of groups, and so though in my everyday life I don't use a lot of the principles here, it's been very helpful for me to give advice to other travelers and for my own personal travel, which sometimes involves adventure travel. So this has been very practical information and helpful for me during the time of this conference.
What do you think, if you had to put a finger on something that you learned that might be new, or a topic that you were really drawn to before the conference, what was it? You put your finger on anything?
Well, there's a lot of things actually. As a surgeon, the wound care information that was given. Some of these new clotting agents was something I was not really aware of, even though that's something I could practically use, and had a major episode of bleeding in a patient surgically, just in the operating room here in the United States.
Right.
Learned about something I didn't know existed, which I'm seeking to have my hospital obtain.
Sure, sure. That's great. Well, we'll be putting this video up on our website most likely, and anything you'd have to say to any of the people who are thinking about coming to the conference, would you be able to give an endorsement of it? Do you think it was a good use of your time?
Yes, one of the things I liked about the conference that it was primarily over a weekend, and it was, even though it was intense, that you got a lot of information, a lot of CME in a relatively short time period.
Yeah,
so that was very helpful from my perspective.
That's great. Well, thanks for coming and thanks for the interview. So here we are at the Expedition Medicine National Conference, and tell us who you are and what you do and how you like the conference.
My name is Alexia Gordon. I am a primary care physician, family practice board certified. I'm also medical director at an outpatient veterans clinic in Harrisonburg,
Fantastic.
Virginia. I don't do any adventure travel myself. I more stick to the green areas on the traveler's diarrhea map.
All right.
But I'm having more and more patients coming home from Iraq and Afghanistan. So I know that I'm going to have to be more up to date on sort of the after effects of things like leishmaniasis and some of these blast injuries and some of these other things that you run into in extreme environments. So I took this as an opportunity to come start making sure I stay up to date on things that I may be seeing more and more often in my daily practice.
And you think it's been helpful? Hasn't been over your head or beneath you, and it's not been too easy or too hard.
No, actually, it's been pretty much right on target. All the speakers have been fantastic. I've actually attended every lecture and stayed awake for them.
Wow!
Which is a
I'm
first
impressed.
for all the conferences that I've been to since medical school. I'm glad that we'll be able to go back on the internet later and get some of the actual websites that some of the speakers refer to, because I'll be able to use those as resources, like when I need to look something up, or actually even sometimes patients will come to me and say, they've got some form from Carnival Cruise Lines needing medical clearance.
That's right.
A cruise, so that kind of thing. It'll help me know exactly what might you run into if you're going to go to Mount Everest. I've never been there. I don't know. So I'll be able to use this as a resource to look it up and make more informed decisions when people come to me for clearances.
And you feel like, one of the things we really put an emphasis on is getting good communicators who come in. Not just people who know the material, but who can communicate in an entertaining and lively fashion and give the information to keep people awake and keep them attentive. You feel like we accomplished that? You feel like the speakers were good?
Yes, I can honestly say you've done a better job than pretty much any other conference I've been to.
Oh, that's great.
That.
That's great. That's great. So we definitely are going to probably put you now on the front page of our website. Get an endorsement. But thanks so much for coming, and appreciate it. In Washington, D.C., at the Expedition Medicine National Conference. Tell us what you've thought about the meeting and who you are and where you're from.
My name is Dr. Salvatore Ficella. I'm an internist in New Jersey. I've been practicing internal medicine and travel medicine for over 15 years. I was invited to this Expedition Medicine Conference, and I'm happy to say that this conference has exceeded all my expectations. The conference has been marked by very interesting lectures, and as well as phenomenal speakers who are world-renowned in their field of interest. This conference has surely broadened my horizons and in the field of expedition medicine, and I recommend it to everyone who's interested in expedition medicine as well as the field of travel medicine. See you back next year.